Why is it illegal to advertise pharmaceutical drugs in most countries?
It's illegal to advertise pharmaceutical drugs in most countries because most countries are smart. What I mean by that is it's only New Zealand and the United States, believe it or not, two countries that allow pharmaceutical firms to advertise their drugs directly to the public. And it didn't exist in the United States until 1997. So for a long time, even in the US, which is very pharma friendly in terms of politicians and big corporate companies, even here, we thought it was a crazy idea for a long time. And then finally, it got through the FDA that, oh, maybe it will be helpful, in fact, to pass along information directly to the consumer instead of just passing it to the doctor. Of course, I don't know how anybody would have thought at the FDA that drug companies were going to pass along and spending tens of millions of dollars in advertisements information to the consumer as opposed to just propaganda. So what we get when we turn on the television or wherever else are drug ads that are meant to sort of give you the idea that they're going to change your world and be cure-alls. And then there's a list of side effects at the end, which we hear that are rattled off so fast that we almost become immune to them. We don't listen to them almost anymore. And it's become a powerful tool for the US drug companies to make sure that consumers, the patients, go in to doctors and ask for the newest and latest drug. Remember, the biggest overhang of this, why do they want to advertise to consumers? It's an odd business because drug companies don't sell directly to us, the patients. They have to sell through the middlemen. The middlemen in this case are doctors. So they have to convince doctors to write prescriptions for the patients. And as a result, they want patients to demand from the doctors the newest products. That's why we get the advertisement. Most of the world is smart enough not to allow that. It's a bad idea when they passed in 97. It's a bad idea today.
After writing a book on pharma, do you see them as heroes who are saving our lives or an industry that is overpromising benefits and understating side effects of their products?
Okay, so I think the subtitle of my book will tell you something about the conclusions, Greed, Lies, and the Poisoning of America. I've tried to do what I view as a balanced history of the American drug industry from the time that it started in the era of morphine and heroin being legal by Bayer, sort of patent remedies and what I call the cocaine cowboy days of the drug industry, no rules, no prescriptions, nothing else required, until we got through the more modern eras of the 1950s and antibiotics and FDA regulation. The thing is that it's like any other industry. If I was doing, let's say, the defense industry or tech or lawyers, I'd find some good operators and some bad operators. The problem is when it comes to drugs, they're affecting our lives in a very different way. They're providing medications that may in fact be helpful or may in fact be injuring us over a period of time. So when you say, are there heroes? There are some people that have over time done some great work inside the laboratories and come up with some real discoveries and haven't been greedy about the proceeds from them. So for instance, when the very first polio vaccine came around, Jonas Salk, who was the inventor of that, was asked in a radio interview, who owns the patent? Who owns it? You? The drug company? Who? And he says, nobody. Could you patent the sun? It's one of the chapter titles of my book, meaning nobody owns it. This is a drug that should be used by everybody. We're giving it away, essentially. That's unusual because most of the time it's all about how much money is made. And that's the second part of the equation. If I find occasionally some people who are doing the right thing inside the labs, trying to do the right thing, where the wrong thing is done is inside the boardrooms, where greed often takes control. And there are too many instances in the drug industry's history in which drugs are found to have bad side effects. The drug companies then go ahead and hide those side effects for decades at a time, leading to injuries and loss of life in instances. And then they eventually get caught. They pay a fine. That's the cost of doing business for them. And so there's a real damage. We're in the middle of an opioid crisis still that's claimed hundreds of thousands of lives. So we know very well what the downside is from prescription drugs. We live in a country, in America, where Americans take 75% of all of the world's drugs. That's an amazing number. Are we healthier for it? I don't think so necessarily. So the long answer to your question, do I find them as heroes? I find some people that I admire that were chasing penicillin discoveries and items like that. And we're doing research on AIDS and HIV and others, but I also find a tremendous amount of greed and villains when it comes to how they have served the American public over the decades.
How did the pharma industry make money on the COVID crisis?
COVID's been a golden egg for them in many ways, and that's not to say that they're not sitting around a boardroom saying we want COVID, we want the next pandemic. But the minute the pandemic takes place, they're sitting around the boardroom saying, okay, what do we do to make sure that there's multi-billion-dollar revenue lines coming in? And there are two different things for that. There are therapeutics to treat it, and we see no better example. I wrote about this early on. Gilead, a small company on the West Coast, had a drug called remdesivir. Remdesivir originally was developed for what they hoped would have been an aid for HIV, or they thought even for Ebola. It was useless. It was never any help. It was funded by the federal government, about $75 million of taxpayer money going through the NIH, some private funding for it. So all of a sudden, Gilead takes that drug, remdesivir, and they say, we think it might be useful against COVID because it has an antiviral. That's what they were testing it for. Turns out that this useless drug on their shelf that was paid for by the taxpayer does show some effectiveness against COVID. It might save 4 to 5 days in a hospital stay. So Gilead then says, we want to license this drug under a special provision of the government's law called orphan drugs. We'll be able to price it at a much higher price. That they were stopped from doing. But still, they priced it at about $2,200 for a full treatment around the world, except in the United States, where they priced it at $3,300, a third higher. Why? Because they can. The drug companies have unfettered pricing power when it comes to the US. So remdesivir is just one example. There are billions of dollars in terms of therapeutics, and of course, there are the vaccines. Billions of dollars in terms of revenue for Pfizer, for Johnson & Johnson, for Moderna. And not only are they bringing in the money now, because they haven't given this away, they haven't shared the research, this isn't free, they're charging for it everywhere, but they are building in what I call a stream of revenue for the future. Because what do we hear about the vaccines? Oh, this isn't like polio, one shot and you're out. This isn't like measles, 2 shots and it's finished. This is going to be recurring shots. It's going to be a bit like the influenza shot. So you need a booster shot for a new variant, maybe in a year or 9 months. We don't know how long it will last. So we'll be talking about COVID vaccines for years to come, billions of dollars in revenue for the drug companies. COVID has been very, very productive for them.